had a patient exam and we did certain procedures and we could only get licensed in one state or a few states. We now have a 60 and above, and we're actively pursuing to get that grant started. Meeting bi-weekly now to open up that program, and it's going to enhance the care for the seniors as well as the experience for our students. We also have a partnership with the DC government along with Howard University Hospital to open a Center of Excellence for Oral Health. Again, that is also a five-year, $5 million collaboration, and we're starting to hire for that program. We also are involved in school-based oral health care program where we have referrals from the elementary schools and DC public schools and charter schools around DC. And we just obtained a Maryland school screening grant for our pediatric dentistry department, who will be screening all the school children in the state of Maryland. The Center of Excellence has the pillars here. We're going to have pediatric service, community engagement, geriatric dental services for special needs, evening dental service, education, training and research, and emergency services. We also have contributions from Procter & Gamble they've donated $50,000 to support our student travel. And our students also are involved in Alternative Spring Break that partners with the rest of the university going to help underserved communities during the spring break, and this is all volunteer. I'll show you more about our community outreach. We can pass that. Okay, this was our post on LinkedIn about the community, the Senior Oral Health Coalition, and we're very proud of our partnership with Delta Dental and that. The pandemic affected us greatly, thanks to my wonderful team, Dr. Mitchell, Dr. Greenfield, the staff. They really stepped up in that time. And we now use a Bison Safe app to enter all the buildings on campus. And then you as guests could also log in, but we take a questionnaire every day and get a pass to come in the building. If you're asked to show it, you have to have a green pass in order to come in. We also opened up a COVID testing center in the College of Dentistry so that our students are tested weekly, and they've cut back on the testing as of June 30th on campus, but we're going to continue our weekly testing because of what we do every day in treating patients. Our students also got to participate in some of the IPE programs that Dr. Rouse was talking about as they partnered with the College of Medicine to do testing, as well as the vaccine clinic they did over the spring, last spring. And they also went out into the community. Ms. Rogers is here. You can see her nice face on the screen. Ms. Rogers is all over the place in DC, and she brings us all of our patients, many of them in the chronically ill and aged program, and goes with the students there, but our students happily volunteer to work in the community for various reasons. Some of our community-based outreach is we have an annual student health fair, Give Kids a Smile group. We also have a special care student organization that puts on the program each year. And one of the highlights of this past year, semester was the Lifelong Medical Care Delta Dental grant that one of our alum, Dr. Miriam Parker from Northern California at Lifelong, she wrote for this grant for Howard students specifically to come out and spend 4 weeks in Northern California, all expenses paid, travel out there, lodging, all of that. And they had a wonderful time, and some of them really want to go back to work out there. That was her purpose, to get more underrepresented healthcare providers out here. So they did that. We also are in Mary Center, Spanish Catholic Center, and we have an opportunity to go down to Eastern Shore Rural Health and Whitman Walker Clinic. We're just waiting to schedule those. This is a picture of our Give Kids a Smile. Dr. Barham and her group in pediatric dentistry did a fantastic job on May 20th. Last week we had ADA there, representative, and it was a great turnout for the young people. This is our special care, Spring Wonderland. It's done Winter Wonderland. That's lifelong medical care though. Okay, that's Eastern Shore Rural Health, Community Outreach, Free Clinical Center, Virginia. Keep going, Remote RAM, all these places, nice. Okay, responses to the pandemic, keep going. Where do we go back?
Let's go ahead. Go ahead. Oh, you got it. There we go.
Okay, 140 years, kind of just 2 minutes. So this is the exciting part of it. Okay.
Go ahead. Go back. Go back. Okay.
Okay, see, our building, 1952. Okay, we're going forward now. Okay, now we're getting a new building. It's promised. In 5 years or so, they're planning to build a new hospital and a new health science center. This is Bryant Street. You notice the facade of, okay, notice the facade. Go back.
Oh, okay. Here we go. Here we go.
I don't know how to
Let
make
me just point to it.
Yeah. Okay, there you go, I found it. Okay, the facade of Freeman's Hospital here. And then it's going to be a STEM center behind it on this end, but that end is going to be the Academic Health Science Center to include all 4 of the health science schools, medicine, dentistry, pharmacy, and allied health. And this is going to be the new hospital. We're really excited about that. And that's just the DC government thing. And our support staff, I have to say, we couldn't do anything without our support staff. They're here. This one, with that one. I want to show that they're involved in central sterilization, stocking our clinics. Business office, we now have our students take their patients to the business office to get their treatment plans signed, to work out their payment options and things of that nature. And then we have PSRs who make appointments for our patients as well with our students. And then here we have 2 of our illustrious, Mr. Woody retired last spring, and then Ms. Rogers. We love Ms. Rogers, we couldn't do it without her. And so the thank you here is to everyone I already mentioned. I love you guys.
I want to thank you so much, Dean, and it appears that in order for us to really have time for the other 2 sessions, that perhaps our Dean Jackson has actually spoken on behalf of the other panelists. So we are trying to finish by 11:30. If everybody could check their watches, and what time is it now? 11:05. So we do want to respect the sessions for Dr. Candace Mitchell and the session for Professor Safa Lawrence. So having been tugged on my left sleeve by Dr. Greenfield, I will set my timer for 2 minutes, and then I will ask Dr. Candace Mitchell to approach the podium. Thank you.
Good morning, everyone. And I'm going to be real quick because Dean Jackson was so very thorough. I'm going to tell a quick something. Dean Rouse wouldn't hire me, but Dean Jackson did. No, I love visiting Dean Rouse quite often, and so I just wanted to piggyback on some of what Dean Jackson already spoke about. She's a dynamic dean who keeps us in check, and we stay very busy in the College of Dentistry. We just have to get connected here. Okay, So I wanted to really quickly speak on what's happened with the dental team and supporting staff in the college dentistry. Thank you, Dean. The pandemic has truly reshaped work in America, and our dental education is no exception. What have we seen with this pandemic, and how has it affected dentistry? We, of course, went through what everybody else did: staff shortages, staff retention, materials management, supply shortages, price increases, workflow restructuring. That was a big one in the College of Dentistry. So what happened? Staff employment. Well, employment in dentistry dropped about 44%, primary voluntary, with concerns about the pandemic. And then with that forced initial closure, many people found other jobs. My friends made more money driving Uber, Lyft, and delivering meals than they didn't want to go back to work. And we experienced a lot of that with our support staff. And then staff retention, the ones you had that did come to work, strive for a better, the pandemic sitting at home for a year. We were fortunate and blessed that the College of Dentistry allowed dental assistants to work from home for a year. Well, what did they do for a year from home? They got to look at educational videos. We had to be creative with them. I came to work every day. I was there 7 months alone, and Dana Jackson became my good friend, because what happened? When many dental offices first closed, we were open. And emergencies came to us from Virginia, from Georgetown, from everywhere. We needed an oral surgeon, and it was a cell phone call away to our oral surgery program. That was exciting. We were able to do that. But meanwhile, back on the ranch, we had a family of staff and faculty at home that we had to find creative ways to keep engaged, and we did. Materials management, go back to retention one time. One thing with retention, people want a better work-life balance. Due to shortage demand, they want higher pay. And if you come to work, now you need to pay me. I'm here, nobody else is coming, pay me. And they have a lower tolerance for a stressful work environment. You heard that, Dean? A lower tolerance for that. So there's a shift in the psychological investment in work ethics that we've had to look at. And serious conversations needed to be held that are still ongoing. Okay, Dean. So materials management, okay, during the pandemic, this was big in a dental school when you usually typically have 360 gallons a day being thrown away, typically, and that's on an average day. So you had to increase in general PPE and PPE and the cost associated. New items, how many new items hit the market? And as a dental school, you want to make sure that people feel safe coming to work. We were bombarded. What do we do? What do we not try? And you only have so much money to use. So we had to watch numbers and working with vendors, anticipate inventory, all those things we went through. And it was exciting, and we got through it because we're smart with the College of Dentistry. Shift in workflows, adding to staff duties, critical responsibilities like overseeing patient COVID protocols, cost covering for other team members. My child is sick, my husband is sick, I'm not coming in, I'm scared, I don't know what to do. We had to look at how we shift our workflows to deal with that. I'm gonna be quick. Go back, Dean. Had to be quick. Wait, what happened, Dean? You lost us. Okay. So then what did we go down, Dean? Okay. No, the other way. Okay. So not only that, it was an impact on our community. Access to care had changed. Cost maintaining and the delivery of care, in particular to vulnerable community of colors. We had to maintain costs when we do this. I do the budget for the college. So I'm looking at those numbers every day. At HU, we had to stay dedicated to our mission to serve the underserved. So if we didn't adjust, they suffer, and we exacerbate the racial disparities that we have been working so hard to try and eliminate. So what do we have to do, and what are we still trying to do going forward? We got to be sensitive to our staff needs and how we support them as human beings. That's a big one, because people have so many different needs, and you get to know them better. As needed, we had to make some compensation adjustments, some, but not many. We're still within a fiscal year. The university is rigid. But they are understanding if you tell your story for the next year, which we've done. Daily clinical team huddles and health checks, increase in cost coverage training, increase in standing meetings with faculty, staff. The dean she is a meeting person. We have standing meetings, and that schedule is tight, and she's always on time. Increased conversations, Dean, go back, almost done. Increased conversations and awareness with the clinical team about dental materials, waste, lead times, materials management. But one thing that's come through this that we can say, and I want to just end with this, is We've had community partnerships that have grown like Delta Dental. Delta Dental, we just hired a community coordinator for evening clinics, day clinics. With the DC Center of Excellence, we've been able to hire an additional clinic manager, a project manager, additional support staff, a patient navigator. So we have all these resources now that will be coming in, an Axiom trainer, a project manager. So we're very grateful for those initiatives and those grants that will help us to continue to grow, especially from all these lessons we've learned. And then on Friday, we have the pre-construction meeting for the Marwa Clinic, the $1.2 million clinic that we will start construction on in the next 3 weeks. So that's it in a nutshell. Thank you.
Mr. Myers.
Well, it's really an honor to be here and have suggestions for staff engagement. One of the things that's a real honor to be here is that, except for Dean Singford, all the other deans and faculty here are my students. That's how long I was at the college. AQCD governing charter includes supporting staff. Staff is a part of the governing body of the college and should be representative on the college's committees. To fully address the disparities in oral health, all shareholders must fully be engaged and understand the missions and contributions that they can make. Sometimes staff, should I dare say faculty too, go through the motions of showing up in the clinic and not be fully committed or have a clear understanding of the missions and goals of the college. By engaging the staff in the college's mission, making this staff an intricate part of the future of oral health will go a long way in step forward in accomplishing our goals. In earlier times, it was drilled into the staff and the faculty that we're an intricate finger of the 5 fingers of dentistry. Civically active, politically informed, professionally competent, community-oriented, and socially conscious. Hopefully, we can agree that this is still the standard for the college. There are ways to fully engage the staff. Regular meetings, but in the regular meeting, it has to be a back and forth and a full cooperative understanding. I'm not there, I'm retired, so I'm not saying that's not the case. But however, and for instance, the dean went back to the construction. And as representative then, they would send me up to the dean, it's too hot, we have to go. It's polite to say perspiring, but the dean was not perspiring, she was sweating. This is in the summer, she's sweating. And she said, Mr. Myers, you go back and tell the staff that I'm suffering with them. And that was the kind of communication we had during the summer with no air conditioning. And once the staff fully understood that she was suffering as bad as they were, and then that was, the staff would go forward with more effort because they understood that this was a collaborative effort. And this is what it would take to reach the goals in the oral health, is for the staff to be fully committed, and they're committed by the kind of interaction that you have between the dean, faculty, and staff. And I'll be short. In summary, create a dialogue with staff, open back and forth, suggestions, and sometimes if you can take a small suggestion, it's not going to affect the health of the patients, the safety of the students, the safety of, and put it into effect, it goes a long way. With my staff, and many of you knew my staff, we work together. I would always say to my guys, if it's not going to affect the health of the patient, it's not going to endanger the student, then work to get the problem solved. And by doing that, I got so much out of my staff, as you all know. You all know my staff well. Thank you very much. It's a real honor being here.
So I want to thank thank this group of panelists, and I also am going to just let everyone know ahead of time that our wonderful Dr. Mitchell has deferred quite a bit of her time in order to try to help us stay on time. So Dr. Mitchell, thank you. And then next will be Professor Safo Lawrence.
Okay, I've been, take this mask off, my goodness. You know, there have been so many people, wonderful people who have spoken before me. I really don't have as much to speak about. I'm tasked to speak about system changes in delivery and management of oral health care. And everything we've talked about this morning has sort of led to that point and why we need the approach. So we have some challenges. We need to create a system of quality, equitable health care for all, identify and integrate multiple partners from varied professions, and eliminate the separation between oral health care and total health care. There's a long history. As we know, dentistry many years ago was focused on teeth and the oral cavity, and medicine was focused on everything else. The profession was very singular. You know, back when I was a kid, your dentist had an office. You didn't hear about many group practices or working in a hospital or public health clinics. Dentists had set up shop, they had an office, and that was their business. And then the most important thing is it was not affordable and available to economically challenged and underrepresented people. What contributed to the change? This is over many years. Civil rights movement, technology explosion, HIV/AIDS, the Surgeon General's report, global economics, and now we've seen more than ever political polarization. Again, back to where we were solo practitioners, largely a white male profession, very cosmetic focused, and these are all things you know, but we've moved to where with the students now, because they leave school often with a lot of debt, we have many employed dentists. I remember going to a DC Dental Society meeting maybe about 5 or 10 years ago, and they were shocked to know the number of graduates that were leaving school, not just at Howard, but at all the schools, that wanted to get jobs somewhere. They didn't just want to go out and take out a big loan and put a sign and have a practice. They didn't, because they were living in that old paradigm. But now we have more group practices and definitely employed dentists in the public sector. I mean, I think it's a wonderful thing. We have all these externships and mission trips and things like that. What that does is that puts a bug in people's spirits, really. Not a bug in their ear, but it puts a bug in their spirits where they are interested in going out to the community and helping and you know, trying to grow. And it also gives them an opportunity to engage with social services, with medicine, with WIC, food programs, with just an abundance of people, with a lot of education and everything. So we're growing in the right direction. So dental education, we have public health system, how the role of dental education and public health has advanced system changes. Well, there's been a lot of collaboration. I think that in terms of, if you look at the ADA versus the ADEA, the education arm is so much more progressive, and they're so engaged in where we're going with our systems. And that has led to us to take a different approach to how we manage oral health care within total health care. So just to bring this to a full closure here for me anyway, I think that when we look at trailblazers like Dr. Singford and others out here who've done so much, they have sort of carried us in this direction over the years, and that has dictated how we provide care. You know, just briefly, the use of technology. I think the dental school was the first Wi-Fi school at London University. I remember that was shortly after I came that they became the Wi-Fi building. We have our electronic health record that it took us a few years to get engaged in, and then we were talking about digital technology. We also have a robust business office where we do take third-party payers. We are heavily engaged in Medicaid and Medicaid managed care. These are things that dentistry didn't look at before, but as we get more engaged with other parts of that, then we are able to utilize the technologies and move forward. It also helps us to look at the other arms, especially with Medicaid, where you have a focus on childhood health and the engagement with their other care providers. When you have a focus now more on senior health, and thank you to Dental for that, because we are able now to look at our seniors. Definitely Ms. Rogers and CIAP, they have laid a foundation for us, and now we are able to support it even more. One thing I do remember is there was a Reverend Wickets program when I was in dental school. And I will tell you, I was doing pretty well getting all the things done I needed to do. I couldn't find a denture. It was horrible. And when Mela saw me, and I guess I was looking sad that day. And she came over and she says, "Oh, I got a patient with you. You know we have these patients in the Reverend Wickets program." And so what that did is that provided me with an educational experience that I very much needed, and it provided that patient with the dentures that she needed. You know, so there's a lot of value to these collaborative efforts, and we really started years and years ago. This is not new to Howard University. This is not new to the College of Dentistry. You know, a lot of the things that we hear now have been going on for a while. They're a little more, I'm trying to think of the term, they're a little bit more organized, and we certainly speak to it more, but it's kind of the core of who we are and what we've done. And I just want to end with, I'm just so proud of being part of Howard University. I'm so proud of being part of this legacy, and I'm proud to be an oral health provider, and I thank all of you.
So while they're doing the technical stuff up here, were there any questions? Because we're really not going to have the full question and answer period, but does anyone have a question that they'd like to ask of the previous presenters? Please.
A great panel discussion. My name is Dana Jackson. I'm chair of oral and maxillofacial surgery at the hospital. I recently came back after about 10 years, and what I noticed was the amount of student indebtedness now is much higher than when I first came through, $350,000 and more. The impact, not only on the students and as they get out to practice, is on where they choose to practice, how they choose to practice, and the impact on education. It's difficult for us to get faculty members to come back because we can't pay them enough. So I would just like some comments from the staff. Now, there are public health programs, we understand that, but comments from the staff and the individuals here. Where does education go? If we can't compete with the private sector, where does education go as far as bringing in qualified faculty for our students?
That's an excellent question. I'm going to ask us to put a pin in that question while those that have the answer can answer it after our next presenter. Thank you, audience.
Good afternoon, everyone. I'm so sorry for the delay. My name is Safan Lawrence, and I'm actually filling in for Professor Smith today. She sends her greetings. It's truly an honor to be here and speak to you all today about some recruitment strategies for the emerging role of allied health dental health professionals in the dental team of the future. So I'll try to keep it brief. Thank you. Thank you, Dean. So in the past, right around the 80s, we're used to the dental team, which was mostly comprised of the DDS, we had specialists, we had the RDH, we had a dental assistant, our lab techs, and administration. So now, as we merge into the 21st century, our current team is comprised of both the DDS and the specialists, the RDH and the hygiene assistant, nurse and nurse practitioners, physician assistants, dental assistants, 1, 2, and expanded functions, health management, health administration, organizational leadership. We have the oral biologist, which we'll talk about a little bit later, implant care specialist, and the dental therapist, which is actually one of the newer emerging fields that is coming about, which we'll talk about a little bit more. We have the community health care coordinator and the community dental health coordinator. The reason why we actually bring, that's okay. The reason why we actually talk about physician's assistants and nurse practitioners, as well as the community healthcare coordinator. As has been mentioned, we need to have an emphasis on the IPE, the interprofessional relationships we have, because now we're finding nurse practitioners and physicians placing sealants or delivering fluoride in school-based programs. So it's really important to, emphasize how important that team and that interprofessional relationship is. So we do have some emerging roles of the allied dental health professions. With the focus on allied health, we have the oral biologist, who serves as a foundation for research, but for also those pursuing graduate degrees with an extra interest while they're in dental school. We do have the implant care specialist. They mostly work with oral surgeons, periodontists, and general dentists with a little bit of advanced training. It's usually a hygienist with continuing education, and it's going to be an asset for that preventative maintenance, especially for implant care. The dental therapist, which is our newest profession, is mostly going to be a dental hygienist that's going to have advanced training and the ability to provide expanded care, including things like simple extractions of deciduous teeth, focusing on prevention and simple restorative procedures. And currently, there are 12 states that authorize dental therapy, and 8 states currently pursuing dental therapy. The dental therapist has different names for their practicing scope. The DT is going to, sorry. The DT, the dental therapist, is known in those first states, the first 14 states that have accepted it. The advanced dental therapist is going to be limited to places like Alaska, as well as the dental health aid therapist, which is going to have a little bit of extra training. So this is going to be a little bit more accepted and recognized as these programs are developing. With the development of our community dental health coordinators, this is a certificate program that was actually established at Southern Illinois University at Carbondale and was funded through a HRSA grant. So it's going to be an adjunct certificate program in addition to the dental hygiene curriculum. And all of these above are going to be preparing those workforce models, which is going to be geared at collaborative dentistry with a focus on primary care. So curriculum examples for dental hygiene programs are going to be accredited through CODA, which we are all familiar with. However, for dental therapy, it's actually going to be non-CODA accredited as well as CODA accredited programs. For example, the University of Minnesota has a dental school, it has a dental hygiene program, and a dental therapy program. It's the only College of Dentistry in the States that actually has all 3 of these programs. And they also have accelerated dental hygiene to dental therapy program. The reason why I mention this is because the dental therapist is going to be really key to reach those underserved communities, reservations, which are formerly known as Indian reservations, those kind of outreach that are not going to have access to care. So dental therapy is becoming a little bit more recognized, as well as they are limited in their practice scope, but depending on the state, they are able to do the abilities that I mentioned before. So in terms of recruitment strategies, as you know, has been mentioned today, Howard has several of those. They have the summer program that many of the former deans mentioned, which was very helpful in having the new dental students being prepared for dental school. They also have recruitments at high schools and colleges, college fairs, health science and transfer fairs, which we have here. People who are looking for career changes, open houses, social media, and websites are all good avenues for these recruitment, as well as volunteerism. Alumni referral is really huge, as we can see here quite a bit. Recruitment comes from alumni. We have our local association meetings, including the Robert T. Freeman and the NEHA meetings. Patients are huge for those of us who are even in private practice or who are also, teaching right here at the College of Dentistry. faculty, staff, we know that patients, they love coming, they're going to refer you to the people they know. When we have the national meetings like ADIA and ADHA, lots of recruitment strategies for that, so very successful. I finish off with saying that as dentistry is emerging, especially when it comes to IPE and just sort of emerging all of the practitioners, we want to make sure that our students are well prepared and well knowledgeable of these emerging fields. And at Howard, it is our focus and our goal to train them so that if they will take on a different career trajectory, let's say they decide to perhaps do a RDH to MPH program, or even a DDS to some of the other specialty programs, that they will be knowledgeable of this space so they can work to train others in the future. I thank you for your time, and thank you for having me.
Thank you very, very much. And we are a little bit behind schedule, but we can do like a 5-minute Q&A, and I think we'll still be okay for lunch. So to get back to Dr. Jackson's question, and I'm probably going to ask for Dean Jackson to respond to it. We heard loud and clear that the financial burden of graduates, especially African American graduates, is exorbitant. We also heard loud and clear that we desperately need well-qualified minority faculty members, and we need for them to be able to be compensated, maybe not at exactly the same level, but at a level that is comparable to what they may be able to aspire to make outside in private practice. So the question is, and correct me if I'm wrong, Dr. Jackson, what opportunities and resources are currently offered at Howard University in order to be able to recruit and maintain faculty members? Dean Jackson?
If I knew the direct answer to that question, I would have fantastically highly staffed faculty at the College of Dentistry. But I'm going to say that being creative and being, knowing what the problem is, we can look at it several ways. So there are faculty loan repayment programs from HRSA. That's one opportunity. There are other loan repayment programs that, public health service and things of that nature that potential faculty can go into. One of the things that has been very popular is to hire retired military faculty. Those who've come out of the military, retired, they're at an age where they are not ready to not work anymore and are very capable and well-trained and have a wide variety of experiences that benefit our students and usually welcome the opportunity to become faculty members. But some come out and want to go into the private sector, which is all within their rights. We also are looking at more scholarships for students that we can possibly get. The more scholarships we can get, the better we can help to decrease their loan values. But again, there are certain specialties that are very difficult to recruit. I heard Dean Sanders say he wanted to teach. I was just thinking that whenever he wants to, we would welcome him to come back a day or a half a day. But really, those are things, and those who are in private practice who want to start to decrease their time. So we don't necessarily get the young people coming right out of school, and they may not be capable to provide, the type of, experiences to our students. But the Louise Ball program that we have is also a way to attract those who may want to be in education and get that advanced training and then come back as faculty. So there are a multitude of ways to be able to address the issue, but it will not eliminate it at all. And we are across the nation affected by low numbers of faculty, especially minority faculty.
I think that was a really, really great answer, Dean, and thank you for that. And I think the other thing is that, and you're next, go ahead. I think that perhaps we need to find a better way of letting potential faculty members know what are the various opportunities and what are the various resources, and perhaps that can be done initially through the Howard University Alumni Network or the listserv that we have, because Dean Jackson mentioned several things, and a lot of our colleagues may or may not really know that those things are existing, but I think it was a great question, and I also think we have a great opportunity to be able to target some of the alumni and some other folks that don't know what they can do, how they can serve.
I also wanted to add, having a faculty practice, which we hope to open, will also help to enhance the income of those who come back to teach. And once our Marwa clinic is complete, which I didn't get to explain because I was rushing, we will be looking forward to opening that and offering that opportunity, not only serving the community and our patients fully, but also enhancing the income levels of our faculty.
Yeah, there's so much information, there's so much for all of us to learn. I'm hoping that we'll be able to do a couple of other sessions, even if they're virtual sessions, because across the country, our colleagues need to know what's going on at Howard. They really, really don't know, and we don't want to curtail the explanations or the presentations, Dean. So let's just think about ways. Let's just think about ways in order to be able to make sure that we're doing some virtual presentations and sessions and that more people can know about it. Good. Richard Myers.
Because I go back a little ways with college. At one time, it was impressed upon the students, community service, and also impressed upon, the students were impressed upon coming back to provide community service. And with the loan repayment programs, it really starts with the students to impress upon them that what their responsibility is to the community.
Well, we have a very strong community service program where our students are out in the community each weekend and during the summers, and all on that right now is all on their cost. They travel to Texas, to rural Virginia, Kentucky, different places, all on their with their own cost and volunteering. We do have a community service requirement as such, where students are required when they graduate to present a collage of their community service experiences. But we now have some funding that we're actually have from Colgate-Palmolive and other donors to donate to funds to help support student travel to these places. And our students are very willing and capable of doing that. And we are alumni as well. Alumni just joined us on trips when we go to different places. They will join us. So we do have great alum and students and faculty who want to give back and do so every day.
They really do.
Very proud of that.
They really, really do. So thank you all for your attentiveness. And then Dr. Barnes, I'm going to ask whether or not lunch is ready. Okay. So the buffet is here, and if these first two tables would like to go to the luncheon buffet, that's perfectly fine. And again, thank you so much. Before we go, I just need to know whether or not Dr. Marsha Butler is in the room. She's there! Okay, come on up, Dr. Butler. Come on up. I couldn't see you. And I promised that we would... So I promised that in introducing our sponsors, we got a chance to hear from wonderful Dr. Horace. Now we got to have a chance to hear from wonderful Dr. Butler, and Colgate is our other sponsor, and she knows she stands between you all and lunch. She knows. She knows.
Hi, everyone. It's so good to see so many familiar faces, and obviously greetings to the deans, Jackson, Singford, Sanders, and Rouse. So good to see all of you and everyone here. So I'm going to keep this quick because I do recognize that I'm standing in between, and I can take this off, standing in between lunch. But I'm just pleased, first of all, to be back at my alma mater. It means a lot and it feels good to me. And I am representing Dr. Julian Barclay, who was unable to attend because she had a conflict today. So I got called, and I was happy to come. And I just want to congratulate you. I didn't know half of what all has been done in so many years, but even recently. And also looking forward to the future. And I have to say that the wonderful work that I've seen today, but also as you lay out, Colgate, and I think I can say this, wants to be a partner as you look forward. And I believe we have their support in doing that. And I think you know that Colgate's been committed too. Not as much in the IPEC space as previously, but that is an interest moving forward, but also in community outreach. And I see so many partners here who have conducted outreach in conjunction with Howard and Colgate, and I want to thank you for that effort. So we're here. I want to say, and I'm putting myself we, as I am a consultant for Colgate now, and we want to be a part of this new future that you're creating. So thank you, everyone. Good to see everyone, and look forward to lunch.